One of the biggest challenges of making an HIV vaccine is that the virus itself is highly mutable. It changes its genome, and that makes it very difficult to hone in on a particular vaccine that will work for all viruses, all HIVs. To put things into context, we get flu shots every year, and flu changes enough every year that we need another shot. In comparison, HIV changes as much in a day as flu does in a year. Our lab works in collaboration with a fairly large consortium called the HINT Consortium. It's at hint.org. It's a multi-institutional collaboration with 13 different labs looking at the early innate response to HIV infection. Now, what does this have to do with vaccines? Well, imagine a vaccine, its primary job is to trick the immune system into thinking that it's being infected. What we want to learn is what is the initial response to, say, HIV after infection, right? And so if we do that, we can effectively recreate the environment that the body sees upon exposure to HIV. And in recreating that, we can make a vaccine that's developed much more effective because it more closely mimics the actual infection event. So this discovery has major implications in the development of an HIV adjuvant. An adjuvant is something that actually increases the effectiveness of a vaccine. So flu shots are often given with adjuvants that increase their effectiveness and lower their dosing. And so although the efforts around HIV vaccines have made tremendous strides in the last several years, the development of HIV vaccine adjuvants have lagged behind. Our study identifies the molecule that actually needs to be triggered to develop this adjuvant. And this adjuvant would increase the effectiveness of a HIV vaccine and really facilitate an accelerated end to the AIDS pandemic through the development of a vaccine that elicits a broadly neutralizing antibody response.